Hi, Dr. Dike Drummond here from thehappymd.com with a quick video to show you three things. One, the difference between stress and burnout, how you can tell the difference between the two. Two, the three main symptoms of burnout so that you can know what's burnout and what's ordinary stress. And three, recent research that's showing that men and women experience the symptoms of burnout differently. Men's burnout is different than women's, as you might expect. Well, research is backing it up, and I'll show you exactly what the difference is. Let's start by agreeing on one thing. Being a doctor is stressful. Taking care of people who are sick or hurting or scared or some combination of those three all day long, and taking responsibility for figuring out what's going on, treating them, and handling their emotional needs at the same time is stressful. You can't go into the office or the hospital and spend a day seeing patients and not expend physical energy, emotional energy, and spiritual energy in that effort. It's draining every single day. And stress is when the drain you're experiencing during your office or hospital day is something that you can refill. You can recharge your energy banks in between your shifts at work. You may be down one day, but you're back up the next, and there's no hint of a downward spiral. So what's burnout? Burnout is when you begin to have a downward spiral in your energy level. Rather than being able to recover between shifts, your energy is dropping sequentially over time. And as you begin to experience burnout, you'll begin to notice three specific burnout symptoms. And these symptoms are measured by an industry standard survey called the Maslach Burnout Inventory. And here they are. Number one is exhaustion. Physical and emotional exhaustion. We all know what that feels like, but imagine going home, resting for a day or two, and coming home and feeling just as exhausted as when you left. That's the kind of exhaustion that burnout will give you. Burnout symptom number two is known as depersonalization. This is a dysfunctional coping mechanism for exhaustion. You're just trying to keep your patients distant from you so that they don't drain you so much. And it shows up as cynicism, sarcasm, and what's called compassion fatigue. You're so tired you have nothing for the other person. You can't be compassionate or empathetic or present for them. And we see this all the time in medicine. As a matter of fact, it's often common to vent in sarcastic and cynical ways. This is actually a sign of burnout. Burnout symptom number three is known as lack of efficacy. At this stage, you ask yourself, what's the use? You begin to doubt whether your work has any meaning, whether it makes a difference, whether it has a purpose, and in some cases you may doubt the quality of the work that you're doing and wonder whether you should continue because your work is subpar at this point. So let's go through the three symptoms of burnout lickety-split. One, exhaustion in a downward spiral. You're getting worse, not better. Two, cynicism, sarcasm, compassion fatigue. Three, what's the use? Feeling like you're not making a difference, your work has no purpose. I sincerely hope you don't feel this way, but let me take this one step further and let me tell you what Christina Maslach described feeling burnout felt like. And this is a direct quote from one of her original research papers. Burnout is an erosion of the soul caused by a deterioration of one's values, dignity, spirit, and will. Burnout literally sucks you dry. So how are men and women experiencing burnout differently? Let's go through that real quick. Just as in any other major medical illness, it appears burnout is different in men and women. Let's go through the differences. In women, it's straightforward. A woman going through burnout will experience the symptoms in the same order as the Maslach Burnout Inventory. Exhaustion, followed by cynicism and sarcasm and compassion fatigue, followed by wondering whether your work has any meaning and is making a difference. At that point, women will frequently reach out for support, let people know they're not doing well, and actually get support to address those symptoms. But what about men? Men are quite different. They tend to begin with sarcasm and cynicism and compassion fatigue as a defense mechanism, unconscious and dysfunctional defense mechanism for the intensity of the emotions and the drain of medicine. That is followed by exhaustion. And what's missing is step number 3 for most men, because men almost never begin to doubt that their work makes a difference, never doubt the quality of the work that they do. This sets up a man to be the classic burned out male doctor, cynical, sarcastic, exhausted, grumpy, and yet still at it day after day, despite the fact that everybody can tell they're toast because they never doubt the quality of the work that they're doing. Another thing men don't do is reach out for help. They tend to become more isolated the more burnout they become, and it's a matter of pride and almost an act of capitulation, giving up and admitting failure for a man to reach out for help. And it doesn't have to be that way. Since burnout's complications can include quitting your career, divorce, drug and alcohol addiction, and even suicide, it's really important, especially for men, that if you have a male colleague who's exhibiting these symptoms, I encourage you to reach out to them. It may be a life-saving maneuver. So where do we go from here? If you're noticing symptoms of burnout, tell somebody, reach out for help, take a break, get your own emotional and energetic needs met. If you have colleagues around you that are obviously suffering burnout, reach out, express concern, ask them how they're doing. And in the next video in this series, we're going to show you burnout's effects and complications and its prevalence rate. And I think you'll be surprised by how common physician burnout is worldwide, regardless of specialty. So this is Dike Drummond at thehappymd.com in the Burnout Prevention video series. Keep breathing, and you have a great rest of your day.